Now it gives me great pleasure to introduce the President of the Royal College of Surgeons in Ireland, Professor John Hyland, to address the guests.
Chancellor of the National University of Ireland, President of the Royal College of Physicians of Ireland, Vice President of the Royal College of Surgeons in Ireland, Registrar Chief Executive, Dean, Faculty of Medicine and Health Sciences, heads of schools, academic colleagues, excellencies, distinguished guests, our new doctor, Professor Aftal, ladies and gentlemen, and of course, all of you, our graduates, the class of 2016. I almost feel like asking you to stand now to give me your standing ovation before you hear this rather than afterwards. But anyway, what I would point out to you, though, is today is a really special day, and it's a great honour and privilege for me to welcome you all here to the Convention Centre on this most important day for our college and also for you, our new graduates. May I particularly welcome so many of your friends and families who are able to share this great occasion with you. And I'd especially like to welcome the guests of our international graduates who have travelled from all over the world to be with you here on your graduation. Today we've had 256 medical graduates conferred from 5 continents and 30 countries. And so to you, our 2016 graduates. After almost 3 weeks, fancy-free in far-flung parts of the world, it is a relief to see you all back safely for this week's events and looking so presentable. I'm told Snapchat from Ibiza has been very busy recently. Today is a milestone in your lives. Sharon Kennedy, your classmate, has just delivered an outstanding valedictory address and is a very hard act to follow. Sharon has been an outstanding student throughout her initial career of physiotherapy and now of medicine, so well done, Sharon. Our new honorary doctor, Professor Aftal, who is an old student of mine, and I will wish him well and not mention any stories from his earlier days and my earlier days. But he has delivered an absolutely, as expected, an inspirational address, and it's an example for all of you of the potential that resides within you. What a stellar career he's had. And yet he remains the same old Nid that he was as a student. So we've been privileged to hear him speak today. I was elected to the presidency of this great college only yesterday, so I'm the new kid on the block. And to allow me to attend fully to the duties of presidency, I stopped clinical practice last week after 34 years as a consultant surgeon at St. Vincent's University Hospital, a few miles away across the Liffey. So you and I have a connection in that you're beginning clinical practice as I finish. I have loved every minute of it, and so I'm a little jealous of you all. And I wish that you have the same happy personal and professional experience in your lifetime. You are in a most exciting place in your lives, with literally the world at your feet. You're now qualified to practice in the area of your choice within medicine in its broadest sense. The qualification which you received today from RCSI, RCPI and NUI are and continue to be highly regarded internationally wheresoever you choose to practice. In this country, currently, unfortunately, there's considerable negativity about the health service, but the media coverage is, in my view, certainly unbalanced and unsympathetic and doesn't reflect the reality. We only ever hear about the bad news stories. Believe me, your college will continue to work to influence government, Department of Health and Health Service Executive. We remain positive in our relations with these agencies for the betterment of our patients, and you know, we must always advocate on behalf of our patients. There are undoubtedly capacity problems within the system, but none insurmountable. The focus in healthcare should shift from cost reduction to quality improvement. Where quality of healthcare improves, cost reduction will follow, but this requires a brave political step. Rest assured, however, that your future is bright, and also that medicine is a really wonderful profession. No others in society have the privilege of serving an individual at a vulnerable time of their life, of seeing them in complete confidence to learn of their physical, psychological and social problems, and to be ultimately in a place, in a position, in most cases, to resolve the issues. Imagine that most of you will get up every morning for the rest